Welcome back to Spotlight. I'm here with Chief of Drugs and Pharmaceutical Services in the Ministry of Health and Social Development, Ms. Gracia Wheatley. And we're going to be talking about keeping your medicine cabinet up to date, right?
Yes, sir.
Good to see you.
Good evening. It's nice to be here again. Thank you
Yes.
for having me.
We are also going to be talking about the effects of the medications that we're taking and monitoring those effects.
Yes.
Because I know we go to the doctor, we get a prescription, and we take in the medicine, and it doesn't quite finish, and then something happens, and then we go to the doctor again before that prescription runs out, and we get another prescription, and the doctor might ask you, well, what drugs are you taking? But particularly if you're an elderly person, you might say, well, if we get it at home and I don't remember. Sometimes you don't remember to bring the medication with us. Even if we're not elderly, we don't remember to bring the medication with us. And
That's true.
And then the doctor just give us another one. And we end up with a whole dining table full of prescriptions, and we don't know.
And then we add our own herbal remedy onto that and our own vitamins and supplements, and we get a whole mess.
Not a thing. So, what, well, first of all, you have some terms that you have to explain to me. And first, there's what something we call RUUEM.
That's RUM, yes.
RUM. What is that?
That is actually an acronym for a project that we have currently running at the Ministry of Health. It's a long-term project. It's where you return unwanted, unused, expired medicines. What that is aimed at is to get individuals to clear out their medicine cabinet. Stop keeping medicines that are old. Stop keeping medicines that you don't use. Stop just stocking up on medicines and keeping them there. Because, sometimes when you have a medicine cabinet full of medicines, they expire. The storage, we store them in the bathroom. With the humidity, they're destroyed. And then we have children who are curious, can get into them and take them. And sometimes we have our elderly or even us. Which one am I supposed to take? Because you have so many in the medicine cabinet. So what we want to do is to help you to manage it properly.
So there's a real danger to our health and our well-being. And I begin to suspect just from your opening comments that this particular situation that we are developing as persons who are on medication, taking medication, could cause our death.
It can. Yeah. It can. There were instances, as you know, I was the chief pharmacist at Peebles Hospital for quite a while. And there were many instances where we had children who got into the parents' medication. There have been instances where our elderly have taken back home medication. They were hospitalized. Medicine was discontinued. But you know us, we want to take it back home. It's ours. So you take it back home, and the next thing you know, they got mixed up, confused, and they took what was discontinued. And it ended up causing a bit more harm.
So do we have instances and situations where these results have happened because of all the medicines we have in the cabinet, and so your department feels that there is a definite need based on data, based on events that's happening in the community, there's a definite need to start educating the community about the situation now?
Oh, yes. I took all of that factor into consideration when we were dialoguing, because the Ministry of Health has overall responsibility for the safety of medicines in the territory. And therefore, it is up to us to implement programs where individuals are kept safe from these sort of incidents.
Okay. So now, how do we with being on Spotlight? You're hoping that people will go into their medicine cabinets and start to clean them out.
Yes.
Okay. I know there's a step-by-step process, and there's a little presentation that we have, and I want to bring that presentation up on the screen.
Okay.
And I want you to go through the whole process of cleaning out your cabinet.
Well,
is that something you want to do?
I'm going to go through it. I can't say I can go through it step by step by step, but I can take you through the process. So the
Okay.
first thing we would want to do is to go through your medicine cabinets, sort it out. What is old? What is expired? What you had for a long time? What you are not taking? Okay, you may have had a cold, or you may have had an allergic reaction, but the medicine was discontinued, or it was finished, but you held onto the container. We want you to sort those out. Then what you have to do is, after that, if you can record the names, that would be good. And then put them in a plastic bag. I have a sample here.
Okay.
I have them in Ziploc bags. But you don't necessarily have to put yourself to the expense of Ziploc bags. Any plastic bag would do. You just enclose it, because inside of the bins has a receptacle for catching the medicine. And the bins are expensive, so we don't want to have them messed up. Okay, we have bins.
So you don't want the medicine to spill into
we
the
don't want it
bins.
to spill, especially if it's liquid or an open cream. Okay, we don't want the tablets all over inside the bin, because these tablets we have to count and we have to note, and because we also want to ensure the safe disposal of medicines, because medicines, if disposed improperly, can harm the environment. So it's a twofold project: keeping individuals safe, but also reducing the harm to the environment through improper disposal of medicine.
So you just can't take the medicine and just put them in your garbage and send them down to Parkwood Pond.
No, you shouldn't do that. You should not do that, because then they would not be disposed of properly. And certain medicines need to be disposed of at certain temperatures and certain different methods of disposing medicines. There's certain medicines that you need to inactivate, like antibiotics. There's a way you have to inactivate it before you dispose of it.
So you're saying, for example, that if we send it to the garbage dump and it gets spilled, the medicine could, the bacteria or some animal or something could eat the medicine and then turn into some three-headed monster. I mean,
No.
But seriously.
If you keep it at home in your garbage, then you run the risk of little fingers getting into your garbage, becoming curious. Or if you have house pets, like me, I have a cat.
Right.
You know, and sometimes he like to go sniffing where he shouldn't be sniffing. Right. You know, so if you keep it in your house, you run the risk of somebody tampering with it. Okay. If you're just disposing of it like that with all your information, you run the risk of identity theft, you know, and so forth. So we are trying not to have these situations occur.
Okay. Now, where do you find, how do you know that the medicine is expired? And where do you look for that information?
Well, it's usually on the side. If you excuse me 2 seconds. On the label, where you would look, you can look around and you can see whether it says MFD, manufactured, and it will give you the manufacturer date. And then it would have EXP, which is the expiry date. Okay, so they are usually in bold black letters. Come to the ending part of the label, or sometimes imprinted on the container itself.
Okay, so you need to look for the expiration date, and then you need to put them. And when medicine expired, it means that it becomes less effective.
Yes, it is losing its therapeutic effect. Yes.
Right. And if you're taking it with something else, you could also it could be also harmful.
It could be harmful. There are some medicines, when they break down, they can become a bit more harmful to the body than if they're stable. Yes.
Oh, okay.
So we shouldn't be taking expired medication. I know there's a belief that you can take it 2 months after or something like that.
Oh, the couple of weeks, it ain't so bad. It just expired. So
it just expired, so I
ain't
can
so bad.
take it.
Yeah.
But there are some medicines you run a risk with your health if you do that, like insulin, for example. Insulin, if it says on the container the 31st of the 10th, 2013, that is the last date of use.
Don't use it.
Don't use it after that, even if you have a full container. Discard of it and protect your health.
Okay. So there are places where you can go to take the medicine.
Yes. We have, currently we have 3 bins. We are piloting this on Tortola, but we intend to take it to our sister islands as soon as we work out everything. So currently we have 3 bins. One is at Kumar, just outside of the pharmacy. One is at the Eastern Clinic, just in the patient waiting area. And there's also one at Peebles Hospital Pharmacy waiting area.
Okay.
So they can access those bins and dispose of their medicines correctly. Yes.
So you take out the expired medicine, the medicine that you no longer need anymore, because some of the medicines may not be expired, but the doctor might have taken you off
of that, yes.
that medicine, and you also don't want that hanging around. So for future use.
Well, that's a lot of things that we like for future use, just in case I get the sniffles again, just in case I feel a fever coming on again. I will have that there.
So we need to get rid of that, put it in a plastic bag, and take it to a disposal site.
Right, one of those participating pharmacies.
Okay, so you're talking about Coma, Medicure?
No, Coma, Eastern Clinic or Iris Pen Clinic, and Peebles Hospital Pharmacy.
Okay,
yes.
good. I don't know.
And we thank them so much for participating with the Ministry of Health on this initiative.
And let's give a shot of what the disposable bin look like. Right.
They are beige in color. This is the model that I travel with, but the bins are beige in color.
Okay, this is white, but the actual bin itself is beige.
Are beige in color, but the
it looks just like just like this.
The format and the graphics that you see, the writing that you see.
So you just deposit your plastic bag with your expired or no longer needed medicine in the place that says open here.
Open here, you just open there, you throw it in, and you close that bag.
Okay. And that's Coma, Peebles Hospital, Eastern Clinic.
Eastern Clinic, yes.
And
no one else. Not at this. Tend to take the project to the sister island, Virgin Gorda and Igara Judgment Day.
All right, cool. Anything else you want to add we got everything else? Everything in?
That, we will deal with the proper disposal. The ministry is responsible for collecting the medicine. So we want individuals to know that the information that may be on the container will not be publicized because the keys are limited. These bins are kept locked, and it's only the Ministry of Health personnel can open the bins and take out the medicine.
Okay.
And then we will take them, sort them, see what is there, and take them to Department of Risk Management for proper disposal.
So persons need to know that the level of confidentiality that is in with your prescription, that's maintained with the disposal.
It's maintained even up to disposal.
Up to disposal, yeah. Because you don't want people to know what your health status is, and they can tell based on the medication you're taking.
Yes, they can.
Okay, cool. Pharmacovigilance.
Yes.
You got me a tongue twister there. Pharmacovigilance. When I type that into my computer, there's no such word.
There's no such word.
Yeah, the dictionary. There's a word. There's a medical term, but the dictionary doesn't recognize it as a word. So you get a red line under it.
Yes. Okay.
But so you got to tell me what pharmacovigilance is.
Well, pharmacovigilance is basically the science of detecting, assessing, and preventing medication reaction, adverse medication reactions. With every medicine that you take, there is a chance that you might get a reaction. But let me say...
This is what we call side effects?
No, the side effects are what you expect because of the natural nature of the medicine.
Okay.
Like if you take antibiotics, one of the side effects is that you can develop diarrhea. But that is a natural process with antibiotics. However, on the other hand, if you have an adverse drug reaction, this is a more serious effect, and it is not associated with the problem that you're taking the medicine for.
So something that happened out of the blue, you didn't expect this to happen.
Right, because there are certain antibiotics, if you take them and you have one of those reactions, it could be what we call thrombocytopenia, which is basically a lowering of the level of platelets in your blood. Okay? And we need to know this information. If we have those reactions, we need to have them documented. So that is basically what pharmacovigilance is. Detecting, assessing, and preventing it from occurring in the future. Okay.
Now that makes sense.
It is like that. It's a combination of two words. Maybe that's why the dictionary didn't recommend it. Pharmaco for drug. And vigilance is our matter to be watchful. So we're being watchful.
Pay attention to the drug you're taking, right? And what it does to you.
Yes.
And how important is that? How important is the need for us to monitor the effects of the medication that we're using?
It's very important because it can save your life. We started a monitoring program at Peebles Hospital in 2005, December 2005. And we have a register of 25 individuals who have come in and reported these adverse drug reactions. We had a person, their tongue, from one medicine that they took, their tongue turned black and it grew hairs. And that is one of the adverse drug reaction with that medicine.
You say that the tongue turned black and the tongue grew hairs?
It became a hairy tongue. Right? So they came, they reported it, and with the program that we have, we go through the medical records and see how many times you've had that reaction. And we try and regain that information, decipher if you have taken more than one medicine, which one it is according to the side effect, the adverse drug reaction that you had. And then what we do is we issue you a card. It's the size of a little credit card, but it has the information on it. Your name, the medicine you were given, what it was given for, and the reaction that you had. Now, with this card, you're free to take this card anywhere you go. And when you're seeking medical advice, the first thing you should do is give the doctor that card so they could know that they cannot prescribe that medicine for you. An instance I can give you is a individual who they took an antibiotic and they had the same experience with a thrombocytopenia. They were scheduled for surgery. If the doctor was not aware that that was an adverse drug reaction that could happen and didn't test that patient to see the level of platelets that they had in their blood, when they went for that surgery, they would have bled out. But the doctor was very vigilant and he did his homework. However, the patient traveled overseas and they got sick. When they went to the physician, they handed the overseas physician, the card. They looked at it and they said, wow, this is good. Because the medicine that they were going to prescribe is the very medication that the person had the adverse drug reaction to. So you see why I'm saying if we are not aware, something bad can happen.
So it's like when you go to the doctor and the doctor says, for example, are you allergic to penicillin?
Right.
Or are you allergic to this drug? Are you allergic? That's the covigilance.
Yes,
that's the pharmacovigilance.
Of the effects of medicine on the body.
Okay, and this is a separate and apart from what the side effects that the medicine will give you in some instances.
Yes, side effects are expected because of the very nature of the medicine. But if you take adverse drug reaction, it's something that you don't want, and it might be a challenge that develops because of the medicine.
Now, is there a monitoring process? Is there a way that one goes about monitoring and recording and keeping a record of the adverse effects that the drugs that they're taking have on them?
Like I mentioned before, they can come to us, the Ministry of Health or Peebles Hospital. We have the forms. We can fill them out. We can look through the medical docket and see. And then we can gather that information.
Okay.
Now, what we can do then afterwards is we issue them the card, but it doesn't stop there. Because we are participating members of the OECS PPS and we have 8 additional countries that might be using the same medicine that we purchase. What the ministry would do is would send an alert to their headquarters in St. Lucia. Then they can contact the other chief pharmacists in the other countries and find out if anybody else is having a reaction to that medicine. Because most of us, the 9 participating countries, buy the same lot of medicine through bulk purchasing. In the one instance, we had some patients in Dominica who had a reaction to the lidocaine, for deadening when you go for dental work. And they had, I think they reported four patients. They had one whose face swole up, one whose eyes swole up, and so forth. And we got the alert at the Ministry of Health, and then we did our local surveillance. Luckily, we didn't have that reaction. But what we discovered was that it had a patient who had a reaction to another medicine. So because we were doing the surveillance, then that came and that person was issued one of the same ID cards.
Okay. We have to take a break. Okay. When we come back, we're going to take a look at the farm and the information that's on it so we could get people a sense of what information needs to be filled in, and some of the things that they need to take responsibility for
Yes.
in preparing the farm.
It's a partnership. We need their help.
We need their help. Okay, we're going to take a word from our sponsors, and we're going to come right back after these words. And we're going to open up the phones. If you have any questions for Ms. Wheatley, about the clean out of your cabinet and the pharmacovigilance, looking after the side effects, not the side effects, but the adverse effect of the medications that you're taking, you can call and ask your questions as well. Keep it locked right here to Spotlight. We'll be right back after these words from our sponsors.
Spotlight is brought to you by Tortola Concrete Limited, Bolo's High Tech Printery, and H. Lavity Stout Community College.
Welcome back to Spotlight. I'm Ed Juenka. I'm here with Chief of Drugs and Pharmaceutical Services in the Ministry of Health and Social Development, Ms. Gracia Wheatley. And we're having quite an informative and interesting conversation about maintaining a good medicine cabinet.
Yeah.
Right? It's interesting. This is something I never thought about. And my mother always had her cabinet full of medicines, and I never saw her use any of them.
Okay.
You know, I mean, it's like the stuff was in there, more stuff came in there, and it was old things, and they were just there.
We should be spring cleaning our cabinets just like we spring clean our houses.
Yes, so we've been having an interesting discussion about that, and the pharmacovigilance is even more fascinating because it's both of life and death situations. Both of them present life and death situations, but I think the pharmacovigilance is also very dangerous. The phone number is going to come up on the screen. There you go. You could phone or you can text if you have a question, make a comment. We'll be happy to hear from you. But I want to ask you about what happens to you. It's fine to monitor and record the adverse effect. Sometimes you might not be able to do that because the adverse effect might be so severe. What happens when you do have an adverse effect of medication? What do you do?
Well, some are visible and some you would know. Okay, you can break out in hives, you can get extra pain and so forth. But there are some that would not be visible and you would not know really like that. One side effect of our cholesterol lowering agents such as Crestor and I don't want to call any names, but those medicines is actually it breaks down the muscle. If you listen to the advert on TV, it tells you if you're having muscle pain or so forth, you must go and check your physician because it is actually breaking down the muscle. So if that is happening, then the doctor would have to switch you to something else because it's going to be dangerous. The byproduct of the breaking down of the muscle is dangerous to the kidneys. So it's not only you would be losing your muscle, but you would also be destroying the kidneys in the process.
But you're able to feel a muscle pain.
You're able to feel muscle pain, yes.
So that's how you would know.
So that's how you would know. Yeah. But sometimes you may think, oh, I've been exercising. Right. So it's obvious that I would have a little bit of muscle pain, right? So I'm getting a bit older, so maybe it's arthritis or something like that. But when we have certain pains in certain areas, we should not take it lightly. So
especially if you're taking medication, as soon as something out of the way, extraordinary, different from what's been happening before, you've never experienced this before, you need to at least call your doctor and say, I've had this experience.
Or
this experience.
More importantly, I encourage individuals to speak to their pharmacist. Inquire about the most common side effects, or the most adverse drug reaction, those that are mostly reported. Because how medicines are made, when they start out in a lab, then we move to animal testing, and then we move to a select group of individuals. But you don't really see all the side effects until it comes on the global market. And that is what individuals fail to realize.
Yeah. And you just made an important point, because when we go to the pharmacy, we don't really have a relationship with our pharmacists.
No, we want to get out of there as quick as we can.
Yeah. And we need to start establishing, right now, we need to start establishing relationships with our pharmacists, get their name, their phone number, so that you can call and say, this is what has happened to me, What should I do?
But not only that, you need to take the names of the medicines that you're on, even the herbal ones and so forth, to the pharmacist so they can check for interactions as they're filling your prescription.
Okay. Now I want to bring up the presentation
Okay.
about how the monitoring process work when you're monitoring for adverse effects on the medication that you're taking. So maybe we could get that to come up on the screen. No. The second slide presentation. I don't know if there it goes. Okay. What are we seeing there?
This is actually
Is that first of all, is that the beginning of the slide presentation?
That's not the beginning, but we can go from there.
Well, let me see if we could roll it up to get it to the beginning.
The beginning might be scary.
Yeah, this
This
looks
is
like,
the
this is the
beginning.
beginning. Yeah,
And
what are we seeing here?
This is actually the birth of pharmacovigilance and how it came about.
Okay, so tell us a little bit about that.
In the 1950s and 60s, when mothers got pregnant and they got nauseated and sickness, there was a medicine that was prescribed for them, thalidomide. It worked wonders. It stopped. But however, when those babies were born, this was the effect of that medicine.
So it stopped the vomiting,
The vomiting and the nausea, and you can go normal. But this was the effect. The babies were born without arms and without legs, as you can see. So then is when they noticed, okay, we need to be a bit more vigilant and start to look at the side effects of medicines. So this was in England, in France, this was all over the world. All reports were coming in and they came together and they said, this is what we need to do. So this is why we are monitoring. This is the pharmacovigilance monitoring. And there's actually a global regional body that's responsible for it in Uppsala in Sweden.
Let's go. Can we move it up? Okay. What are we seeing there? Can we bring that up on close up on the screen? What is that we're seeing there?
That's rhabdomyolysis. It's a tongue twister.
Yeah.
Basically, what this is, it is showing the effect of medicines on the body. This is one of that would happen when you're taking one of the cholesterol lowering agents if you have that reaction. As you can see on the left, you have nice full muscle fibers. Then as you move to the right, you see them getting smaller. And then this is what is happening with that effect.
And they cause the pain.
So it will be causing the muscle pain. But as the fibers are breaking down, the myoglobin is harmful to your kidneys, so you could also be hurting your kidneys as well.
Okay, so let's keep moving moving the slide. Yes, and this is
in the BVI. In the BVI, we like to take a lot of paracetamol. Really? I have a pain, I run and I take paracetamol.
Yes.
And you know the saying: if one is good, two is better, three is even best. So, but paracetamol doesn't like the liver. So that is one of the side effects if you take the excessive dose of. You stay within the normal dose and you don't abuse the paracetamol, things would be fine. But like I said, sometimes we double up and we triple up because we can't wait for it to kick in. But then it can end up destroying your liver. So
the liver on the left is a healthy liver, but
that's a healthy liver.
But on the right, you could see the effects of the
paracetamol on your liver. Yes.
Okay. Can we move up? Okay. Now, what we're seeing here is the recording process.
Yes, this is a form that is used, that is filled out. Your name, your initial, the reaction of what happened, whether or not you recovered from it, whether you recovered, hospitalized, the person expired or died, and so forth. And then the lines tell you the name of the medicine, the dose, why it was given, how long, and when we began investigating, and so forth. And then we have the boxes at the bottom for the recording individuals, your physician, your pharmacist, your nurse, to make sure that this is authentic and this is official.
Okay, let's move. Can we move it up? Okay, what are we seeing there?
This Eduinka is the card that is issued to individuals after that form is filled out and we have done all the work. So as you can see, it has on all the information. This one here, an individual who had an allergy to paracetamol, that's actually now coming up. Where they lost the top layer of their skin. Now, if you lose the top layer of your skin, you're exposing yourself to bacteria or whatever.
That's serious.
So that's very serious. So this is all of that. It says sludging of the external tissue, what was done. So now this individual has this card and can present it when they go.
When they go anywhere in the world,
Anywhere
for
in the
medical
world.
service, the first thing they
Yes.
do is say, "This is my card with
Right.
adverse drug effects," so that the person the doctor,
The doctor
or
who's
whoever's
prescribing or the
prescribing,
nurse, if the nurse is administering, yes, it has on all the contact information if they need to call the health individuals in the BVI or to get in contact with one of the person's family members.
Okay. And
That's just the backside of the card.
okay. And so that's the end of that's the end of the process. This is okay. This is like it's not like a table.
This is actually a table because remember we spoke about taking the names of your medication to the pharmacist or to the doctor so they don't be over prescribing things that would interact. And that is a form that they can use that has the name of the medicine, how long to take it, what it is for, and the time, and so forth.
So when you get a prescription, you need to take this form and make a list of the prescription on that table, and all the medications that you're taking.
Right.
You need to have it listed on this
Right.
on this
In
form.
the event you're at work and you can't take the medicine to the doctor, you take sick, at least you have the
And you
form
should have
there.
that with you all the time.
All the time. You should keep that on your person. Yes.
Okay, cool. We following the tyranny of the clock. you see the tyranny of the clock, right?
Okay.
And the tyranny of the clock is on the screen. But I think we got we pretty much covered the
Yes.
most of what we wanted to cover.
Yes. I want people to know about the pharmacovigilance.
Yes, and so what I forgot to ask you, or what I didn't ask you that you wanted the information you want to get out.
That the program is not yet national, but is being designed to become national. And the forms will be available in every medical center in the next couple of months.
So the farm is not
Currently,
being prepared right
the
now.
forms are at Ministry of Health and People's Hospital.
Okay, so you could get your farms from People's Hospital
Right.
or the Ministry of Health.
But we will be rolling out on a national level where every private doctor physician office would have the forms.
Yes. And we need to everybody needs to pay attention to this and start to use these forms and keep a record of the adverse effects, report it, make sure that they have their card so that in the event that they need to be someplace else other than here or any doctor,
Any doctor.
they have that information to present.
Okay.
It could save their lives.
Could save their life. And just briefly, we could mention that this monitoring system could lead to the way medicines are prescribed. If the medicine should be taken out of the market or just a select few physicians for prescribing.
Thank you very much.
You're welcome.
Yes, it's real good information. I really appreciate you taking the time to come by to bring the information to us. And of course, we thank Dr. George as well for being here. Some really important information today. I want to say that Farmers on the Move is hosting their second free Agri Seminar at the HLSCC Marine Center, Sundays from 2 to 3:30 p.m. starting August 25th through to October 6th. Topics include agribusiness, composting, irrigation systems, small ruminants, husbandry, and safety at sea. For registration, call 496-7190 or email coytosis@hotmail.com. Spotlight is rebroadcast at 2:30 on Sunday afternoons. You can also catch up with all the spotlights, including this program, on jtvlive.net if you miss any part of it. And it's a really important program. You need to check it out. You could see it at jtvlive.net at any time. Tune in next Tuesday right here on JTV Channel 55 for another important edition of Spotlight. Thank you for watching. Thanks for your words of encouragement, your suggestions, and criticisms. Continue to email me at jtvspotlight@yahoo.com. I'm Ed Juenka, reminding you that when the spotlight is on, you see the facts. Peace and blessings.
Spotlight is brought to you by the National Bank of the Virgin Islands, Clarence Thomas Limited, the BVI Tourist Board, and CCT Global Communications.